Hello everybody. I bring my greetings from the city of Nashik. My name is Dr. Deodatta Chafekar. I am a specialist doctor in kidney diseases, hypertension, dialysis and kidney transplantation. I have been working in the city of Nashik since the last 29 years. I have graduated from St. J.S. Medical College, Mumbai, and I have been practicing at Supreme Kidney Care at Nashik near my co-circle, as well as at Ashoka Medicover Hospital as a consultant nephrologist. Today, it is my pleasure to talk to you regarding edema. What is edema? Now, edema means swelling. Basically, whenever you talk of edema, in most of the cases, there is fluid retention. That means the amount of water in the body goes up. So, whenever there is fluid retention, you will get edema. Edema is a medical term for swelling. Now, why does the swelling occur? Because the blood vessels in the body, especially in the lower limbs, they have an increase in the volume and some amount of liquid. It comes out of the blood vessels, causing swelling, and it gets collected outside the blood vessel in the tissues, and that is called as edema. Now, generally, whenever we talk of edema, then we have to find out whether it is on one side of the body or whether it is localized at one place or whether it is all over the body. If it is localized at one place only, then the causes of edema could be different. However, if the edema is generalized all over the body or specifically over the face and the feet, then the causes could be different. So, whenever you have edema, then you also need to find out what is the duration of edema, since how long you are getting the swelling. You can have a situation where the swelling goes up and down. That means it reduces on its own or it increases due to some reasons. You can have the swelling or edema only on one side of the body or only in the feet or all over the body. You can also have swelling along with associated symptoms. So, for example, if you are having swelling or edema only on one side of the leg, it can be associated with pain, fever, and inflammation. Suppose you are having edema on both the legs. It can be associated with generalized symptoms like hypertension, weakness, anemia, lesser urine output, breathlessness on exertion, etc. etc. So we have to analyze edema depending on what is the cause. So now let us go and find out what are the possible causes of edema. Suppose a patient comes to me with a complaint of swelling. Initially, I will find out whether it is unilateral, that means only on one side of the body, or it is bilateral on both sides, or it is generalized. If it is unilateral, then the possible causes are only 2 or 3. Unilateral means only on one side of the body. So generally, such kind of swelling could be due to what is called as venous edema. You know that there are blood vessels like arteries and veins and lymphatics. So whenever you have venous edema, the veins either they are blocked or they are dilated. So for example, in the lower limbs, you can have a condition of varicose veins which can cause edema. Similarly, venous thrombosis or venous obstruction, that means blockage of the veins, due to clots can also cause edema. At the same time, because of the blockage of veins, it can occur at multiple places also, but generally it occurs only on one side. The second cause of unilateral, that means only one-sided edema, would be cellulitis or inflammation. That means there is some local trauma or local inflammation due to some cause which has resulted in infection, and the infection is causing pain, fever as well as edema, and locally the temperature goes up. So again, this is one of the local causes of edema. A third local cause of edema can be related to lymphatic obstruction. That means just as you have arteries and veins, you have other vessels called as lymphatics, and these lymphatic vessels, they are connected to the lymph nodes which are present all over the body. Now, lymph nodes are related to our immune system, and lymphatics are vessels which carry a fluid called lymph from one lymph node to the other, and they are spread all over the body. Whenever you have obstruction of the lymphatic vessels, again you will have edema. Now, the most common cause of lymphatic obstruction is elephantiasis. That means it is an infection due to filaria. So whenever you have filariasis, it results in lymphatic obstruction, and then it results in elephantiasis or swelling of the body or swelling of the localized part. Now remember that all these types of edema are supposed to be non-pitting. So what is pitting and non-pitting edema? Whenever you press over the shin of the tibia or over the leg, just above the ankle, if there is a swelling and if you press there, then there is a depression which is created like a pit. So that is called as a pitting edema. But sometimes the edema is not pitting, the no pit is created in spite of adequate pressure for adequate length of time. In that case, it is called as non-pitting edema. So examples which I gave you, venous edema, then elephantiasis or filariasis, cellulitis, all these are causes of unilateral, that means one-sided edema, and that is usually non-pitting in nature. Now let us come to causes of generalized edema or bilateral edema. Bilateral means on both sides of the legs or both sides of the body. So what are the causes of bilateral edema in the lower limbs? The common causes are related to either a kidney disease, second a heart disease, or third a liver disease. So whenever we have bilateral edema, we either want to find out whether the patient has got an associated kidney disease. So an associated kidney disease can be due to various reasons, but many times in patients with kidney disease there is a condition called nephrotic syndrome where there is loss of protein in the urine, and it is one of the common causes of generalized edema which starts initially in the legs, then you also have puffiness of face, and then it spreads all over the body. So kidney disease is one of the important causes of edema, starting in the lower limbs, then in the upper face, and then all over the body. And generally in nephrotic syndrome, the reason is because you have the hypoproteinemia because of protein loss in the urine, and due to this there is hypoalbuminemia, that means there is less albumin in the blood, which causes edema. Now whenever we talk of kidney disease and edema, there are some kidney diseases where edema comes a bit late. So initially there is no edema. But whenever the kidneys are swollen, or if the kidneys are not functioning properly, then you will have edema. This is generally related to less urine output, and you must ask the patient whether the patient has got adequate urine output or no. So, kidney disease is one of the important causes of edema, and we have to evaluate patient for kidney disease, especially if he also has uncontrolled high blood pressure or he also has low hemoglobin. These are all situations where kidney disease is suspected. The other important cause of edema is a liver disease. So whenever you have a chronic liver disease, again it results in hypoproteinemia or hypoalbuminemia, and that results in edema, which again it starts in the lower limbs and then it can spread all over the body. A distinct feature of liver disease causing edema is what is called as ascites. That means there is fluid retention inside the abdomen and you get abdominal swelling along with edema. That could be a sign of liver disease. And all of us know that liver disease can occur due to viral infections. It can also occur due to alcohol intake, chronic alcohol intake, or it can also occur due to some systemic disorders. A third important cause of edema is a cardiac disorder. Whenever you have a heart problem and the heart is not functioning properly, or the pressures in the heart are higher, then the pumping capacity of the heart goes down, and then what happens is that the veins become congested, and because the veins becomes congested, then you get edema, especially first on the legs and then followed by edema all over the body. And these patients, they generally have complaints of breathlessness. The breathlessness especially worsens in lying down position and slightly better in sitting position, and this could also be associated with low urine output. So whenever the heart functioning goes down, again you can get edema. So the important causes of generalized edema are either a liver disease, a heart disease, or a kidney disease. Now besides this, there could be one more cause of generalized edema which is classified under endocrine disorders. What is endocrine disorders? Disorders related to endocrine glands. And the common cause of edema all over the body, which is related to endocrine disorders, is hypothyroidism. So whenever you have a thyroid gland which is functioning suboptimally and not producing adequate thyroid hormone, during that time you will see that there could be edema, but again this edema goes into non-pitting types, but it could be a generalized type of edema. Now interestingly, the word edema has also been used for specific situations which could be very, very important systemically. So for example, somebody might say that this patient has got pulmonary edema. What is pulmonary edema? That means there is fluid retention in the air sacs in the lungs, especially where the oxygen diffusion takes place from the lungs to the blood, and we get oxygen which is coming to the blood, which is supplied all over the body. So whenever you have fluid in the air sacs in the lungs, you will find that these patients, they get breathless, the oxygen saturation goes down, and this is called as pulmonary edema, and this is an emergency. And pulmonary edema can be due to respiratory causes, or it can be due to cardiac causes, that means heart disease, or it can be due to hypertensive heart failure, that means uncontrolled blood pressure, or it can be due to infections, or it can be due to non-cardiogenic causes also. So there are many causes of pulmonary edema, but remember that whenever you hear pulmonary edema, it is an emergency. A second term which is used is called as cerebral edema. What is cerebral edema? Cerebral edema is a term which is used indicating there is swelling of the brain. So whenever you have swelling of the brain, remember that brain is in an enclosed area and there is hardly any space for expansion of the brain. So whenever you have the brain tissue which gets swollen due to some reason, it is called as cerebral edema. And cerebral edema is also an emergency. It is also an important thing which should be diagnosed very, very early. And again, cerebral edema can occur because of venous obstruction, it can be because of infections, or it can be because of other causes like obstruction to the CSF flow. But again, it's an emergency. A third important area where the term edema is used is called as macular edema. Now you know that macula is a area in the eye which is related to the retina. And if there is a retinal fluid which leaks and this builds up in the area of the eye called macula, then it is called as macular edema. And remember that macula is in the center of the retina, and macular edema can give rise to progressive blindness. So again, this is also an emergency. So what I have tried to tell you is what are the systemic causes of edema, what are the unilateral and bilateral causes of edema, when is edema very, very sinister and when it is an emergency, and which are the other areas in the body where edema can be suspected. For example, macular edema, pulmonary edema, as well as cerebral edema. I must also mention a few other important causes of edema besides whatever I have told you. One of the important causes of edema is an allergic reaction which occurs specifically at a specific site. It could be related to an insect bite, or it could be related to a drug reaction. And if that occurs, then it is usually associated with pain, local swelling, and local increase in temperature, and this can result in edema. You have to elicit the correct history to find out if such a thing has occurred. One important phenomenon is called as angioneurotic edema. Now, angioneurotic edema is a term which is used for anaphylaxis, and anaphylaxis is again a type 2 allergic reaction in the body which occurs due to various causes, but this is a life-threatening emergency because angioneurotic edema occurs in the respiratory tract and at the level of glottis and epiglottis, and this would result in difficulty in breathing, fall in oxygen saturation, and this can become a life-threatening emergency. So angioneurotic edema is another important term which one must remember. The other important causes of edema which occur all over the body is, one is hypoproteinemia. Whenever you have less quantity of protein in the blood, then what happens is that the capacity of the blood vessels to retain fluid inside the lumen of the blood vessel goes down, and in that situation you will have exudation of fluid which comes out of the blood vessel, and then you will have edema. So this edema is related to hypoproteinemia. This usually occurs in liver cirrhosis or liver diseases. However, it can also occur in starvation and in people who have severe hypoproteinemia due to various causes, and it can also occur in children where there is severe protein energy malnutrition. The other important cause of edema can be due to pregnancy. So now in pregnancy you have some edema which could be acceptable, but remember that if you have edema which is out of proportion in pregnancy, then this should be investigated because it could be related to a condition called preeclampsia. Preeclampsia is a condition where there is rise in blood pressure, there is loss of protein in the urine along with edema, and then the pregnancy can become eventful. That means it can cause problems as the pregnancy progresses. So therefore it is important to remember that if there is edema in pregnancy, then a small quantity of edema can be physiological, but you have to rule out preeclampsia whenever there is edema during pregnancy. One of the other causes of edema in menopausal women could be related to hormonal imbalance. So whenever you have menopause, you know that there is an imbalance between estrogen and progesterone hormones, and in that condition also you can have fluid retention as well as edema. And one of the last causes of edema, which one must not forget, is medications. So some of the medicines which we administer, for example, we administer medications like those which are used for control of blood pressure, and oral contraceptive drugs as well as hormonal pills. All these contribute to edema, and one must not forget about history of taking medications. After having known about what is edema and what is the classification and what are the causes, now let us discuss how do we approach a case of edema. So remember that history is very important. You talk to the patient regarding history of drugs or medications, history of drug allergies, history of allergic reactions, insect bites, history of fever, history of the liver disease, history suggestive of heart disease, history suggestive of kidney disease, or history suggestive of thyroid disorders, etc., etc. So whatever causes we have discussed, you can ask the related history and try and find out whether it can contribute to the diagnosis. Secondly, always find out whether the edema is only on one side of the body or both sides of the body, it is pitting or non-pitting, whether the patient has got systemic symptoms along with edema, for example, breathlessness on exertion, abdominal distension, constipation, weight gain, or headache, or symptoms suggestive of both liver disease, kidney disease and heart disease, etc., etc. And on examination, you will definitely get some signs of all these causes, which can give you a clue as to the cause of edema. And try and find out what is the best possible diagnosis as far as the cause of edema is concerned. Now, how do you manage a case who has got persistent edema? The management essentially depends on the cause of edema. If it is unilateral, related to infection and cellulitis, then you have to treat with some local medications as well as antibiotics or anti-inflammatory agents, and then the edema would subside in a period of 1 or 2 weeks. If it is a venous edema, the patient would require investigations like a Doppler examination, Doppler sonography, or the patient would require some other test to find out whether the patient has got a venous blockade, and that will also tell you the cause of venous edema. The other investigations which may be required to prove or disprove a heart disease would be an ECG and echocardiogram, kidney function test, liver function test, a sonography of the abdomen. To rule out hypoproteinemia, you can have a serum albumin estimation. You can do tests for thyroid function. All these are investigations which can help you depending on to find out what is the cause of edema. Now, the history I already mentioned, that you can ask about breathlessness on exertion, breathlessness which gets better in sitting position, whether the patient has got cough, whether the patient has got other systemic symptoms, etc., etc. Now, generally, if you talk of treatment, I already mentioned about the local treatment. If the patient has got a significant heart disease or a kidney disease and there is fluid retention, remember a few things which are very, very important. Always measure your intake fluid intake and urine output and maintain a chart. So whenever you are having edema all over the body, this intake output chart is very important. If you drink a lot of fluids and if you produce less urine, that fluid will be retained inside the body and will contribute to edema. So a situation where the intake is much more than the urine output, that can contribute to edema. Second, go into the dietary history and find out whether the patient has got a very low protein intake and try and increase the protein intake. Third, also find out in the dietary history what is the salt intake. And if the patient has got a higher salt intake, that also can contribute to fluid retention, because as you take more salt, you feel more thirsty, and because you feel more thirsty, you consume more liquid. So therefore, high salt intake is also very, very detrimental to a patient who has got generalized edema. The fourth important thing which we do is you can do leg elevation. That means at night you can elevate your legs and sleep so that by the morning time the edema would be redistributed. It doesn't disappear, but it can be redistributed. If the patient has got a thyroid disorder, then the correct treatment has to be taken under medical supervision. If the patient has got fluid retention and is producing less urine, then there are some medications which are available, which are called as water pills, and these pills can be given by the doctor so that you produce more urine, and then the edema would definitely reduce. But remember that anything which is consumed in high quantity will be giving rise to its own problems. So water pills can cause its own side effects like electrolyte imbalance or a fall in blood pressure, etc., or the patient can start feeling giddy. So one has to be very, very careful whenever you are using all these pills. Remember that no medication should be used without a doctor's prescription, and it should be used only under the guidance of a qualified doctor. Then the other things which you can do, if it is a chronic edema, then you can use what are called as stockings. And these stockings will help you to drive the venous blood up, and it will reduce the retention of blood in the lower limbs, and these venous stockings are used to prevent deep vein thrombosis. So that is called as compression stockings. Remember that in some patients with edema, we tell them to take bed rest, because if you exert, then in those patients are not going to improve quickly because the fluid remains in the lower limbs. Also, try and avoid sitting position or standing position for very long periods of time, because the fluid is retained in the dependent area of the body, and therefore you will have a lot of retention of fluid in those areas, and therefore the edema will not go down. Also remember that if you have edema, then avoid injury to that part, because that part is not going to heal quickly because of the swelling itself. These are some practical tips of how do you manage patients with swelling or edema. But remember that it is very important to go into the history, contact your local physician, try and find out what are the causes of edema, and then treat it judiciously. So friends, in this particular communication, what I have tried to do is to discuss with you regarding edema or swelling, either localized or all over the body. And I have tried to tell you what are the possible symptoms, signs, what are the causes, and what is the possible treatment of edema. With this, I come to the end of this particular communication, and I hope that this presentation will definitely give you some knowledge about this particular problem and help you to treat either yourself or your friends and colleagues. Thank you very much for your attention.